As I mature as a surgeon, things change. Everyone is in a process of reevaluating their own work. And over the past 20 years, doing scar revisions and surgeries that require a cut on the skin, especially in areas of high sensitivity, like in the middle of the face where scars are, make me revisit and think about things. And so initially, I was a big fan of doing shorter epidermal and longer dermal sutures. The shorter epidermal suture I did because I didn't want to have track marks or visible cuts on the skin or having issues with sutures irritating the skin on the surface. I also did not want to have visible sutures that were there for too long because patients will be irritated to see visible sutures. At the same time, I used very long dermal sutures, deep buried dermal sutures that's below the skin, because I wanted that not to have the skin separate, and that's the reason I would leave those buried, deep, dissolvable sutures for very long. In 2015, I was lecturing in Russia, and they were talking about using something called 7/0 Vicryl, which is a really tiny hairbreadth suture used for closing rhinoplasty stitches or rhinoplasty incisions, and it really, really changed everything for me. I started to see my results look so much better. The reason is that I believe several reasons. One is the sutures are there for a long, long time, and so that the epidermis does not have a chance to stretch back, because the biggest offense or the biggest problem with scar revisions is epidermal stretch back, where the epidermis, the outer layer, stretches back. The other thing that was amazing and fascinating is that in the old days, when I had to use nylon in the rhinoplasty, I would put in maybe 3 or 4 sutures because they were so painful to remove. Now, under magnification, if I find something I don't like with the incision, I'll put in 30 sutures because they don't have to be removed. And because they are white colored and really tiny like a hair, they're not very visible. And I found that even when African Americans, because they're so thin and tiny, that even if they're there for a few weeks, it's not an issue. They don't leave track marks, although theoretically that's possible. Track marks being the suture visibility of like the marks that the sutures leave behind. But they really minimize the risk of stretch back. At the flip side, I've been using much shorter dermal sutures. I used to use PDS or polydioxanone sutures that last like 6 to 12 months to hold the deeper tissues together. One, I found it was unnecessary. And the second thing I found was when I used them, they could spit. And when they spit, they open the wound up and they cause separation. I now use, for the most part, monocryl, which is a much shorter acting suture between 2 to 4 months. And that leads to less spitting. And I use many fewer of those sutures. I used to use quite a few sutures. So I'm now reversing it with a longer epidermis. And I do that for everything. Now I've done upper blepharoplasties, facelifts, scar revisions. I just did a upper blepharoplasty earlobe repair for a gentleman that had bad blepharoplasty and facelift done elsewhere with these types of sutures. And I know he's going to heal exceptionally well. So this is just maybe a subtle distinction of how I've changed over the last 5 to 10 years, and why I think this is something maybe important in case, especially if you're coming to me for any kind of surgery, you may wonder why I'm using dissolvable sutures. What is the point? Is it because of laziness? And actually, it's nice. My staff doesn't have to take out the sutures. It's also nice for my out-of-town patients. So a lot of patients that come in for a mini facelift or facelift, if there's not too much swelling, I can take the drains out the next day. They can oftentimes leave the next day. There are no more sutures to remove. So on rhinoplasties and facelifts and everything, on lip reductions, all those things are dissolvable sutures, so I don't have to remove anything anymore. So that's also a nice bonus for my patients.